Alright, so this is the lecture Ang Kwento ni Rosario, Analyzing Health Inequities Through Documentary Lens. So short introduction lang to the documentary. So Ang Kwento ni Rosario is a documentary following the events leading to the tragic death of Rosario, a Filipino facing health challenges due to socioeconomic factors. It explores themes of poverty, access to healthcare, education, and social support. It highlights how social determinants of health shape individual and community well-being. So what are social determinants of health? Again, these are conditions in which people are born, grow, work, live, and age that affect health outcomes. Key social determinants of health in the documentary include economic stability, so we have poverty and unemployment, education, poor health literacy, healthcare access, barriers to primary care. So remember, malayo sila dun sa hospital, hindi accessible sa kanila. And because of their poverty, hindi sila makapunta. Neighborhood and environment, they are living in an unsafe, unsanitary living conditions with no running water. And there is also no sanitary toilet. If I'm not mistaken, directly sila sa river. And social and community context, lack of support systems. Okay, so Rosario's story is a case study in social determinants of health. So economic hardship, struggles with low income affecting nutrition and healthcare access. Healthcare barriers, there's a malayo yung clinic, mahal, tapos wala silang insurance. Education and awareness, there's limited knowledge about preventive healthcare, such as nutrition and vaccination. And yung milk, ang ginagawa nila is tinitimpla nila yung evaporated milk plus water, di ba? And there's also social isolation, lack of family and community support, which is exacerbating the health issues. So because there's no family or community support, they have no one that they can turn to whenever there is a health crisis in the family. So linked to primary healthcare should address social determinants of health by providing accessible and affordable care, community health centers, and subsidized services, health education, preventive care awareness, and community-based interventions, outreach programs for marginalized groups. Key takeaway of this document is that social determinants of health deeply impacts health outcomes like poverty, education, and environment, and these matter just as much as medical care. And primary health care must be equitable. Policies should target underserved communities or the people who really need it. Advocacy and policy change strengthen PHC systems, can reduce health disparities, primary healthcare systems. All right, and these are my references and further reading. So I hope you enjoyed the documentary and that you learned something. We will be including the documentary in the exam, so make sure that you watched, and you understood what happened to Rosario. Okay, thank you.